Thank you everyone for joining us today. We'll be presenting a webinar on what employers and HR employees need to know about Medicaid unwinding. So today we'll have, I'm the moderator. My name is Stephanie Sievers. I'm an insurance literacy and communications manager from Covering Wisconsin. We'll have two primary speakers, Caroline Gomez-Tom, who's an enrollment network and accessibility manager from Covering Wisconsin, and Adam Van Spankeren, who is our navigator program manager. Additionally, we'll be joined by Maciel Gomez, who is the enrollment and outreach coordinator for the Wisconsin Department of Health Services. She can help answer some of the more difficult questions that are directly involving DHS. So thank you, everyone. So please ask a question at any time by using the button at the bottom of your screen. That is the Q&A symbol. And depending on the question, we'll either pause and answer it at that time or wait until an appropriate moment and pause and answer those questions. So let's go ahead and keep populating the question tab. Okay, so our agenda for today, we're going to talk a little bit about who we are, so you know who's presenting this information to you and the free enrollment help that we can provide. We want to talk a little bit about why this topic will be important for employers. And we'll get down to the real basics of what you need to know about Badger Care Plus and Medicaid. We'll talk about, for those who are no longer eligible for Medicaid, what their options might be and the steps that will allow them to access those options. We'll give you some support tools to help to make a referral when needed. We'll have some free outreach and educational materials that you can share with your employees. And lastly, we'll give you some key messages and takeaways that are summarized and easy to capture and remember. And we want to thank today's sponsors and hosts. That's the Milwaukee Enrollment Network, the Alliance, Covering Wisconsin, Milwaukee Healthcare Partnership. And I just realized I'm not sure for the logo for BHCG.
Business Healthcare Group.
Thank you.
Absolutely.
Okay. Caroline, I'll let you take over.
Wonderful. Thank you, Stephanie. And thank you everyone for being here today. And thank you for our sponsors and our partners. We're really glad to be in front of you all today, knowing that this is such an important moment in this transition after the pandemic, and making sure that all folks in Wisconsin, all Wisconsinites, including all of your employees, are continuously covered with whatever coverage they're eligible for. And so I'm just so excited to be here talking with you all. First, I wanted to introduce Covering Wisconsin. We are an organization that's grant funded and a part of UW Extension at the University of Wisconsin-Madison. And we help people find and use their health insurance. The way we do that is through our health insurance navigators, where we are federally funded by the Centers for Medicare and Medicaid Services to help people find affordable coverage either through the state's Medicaid program or the health insurance marketplace. And we have folks that serve statewide in all 72 counties. And then we also pride ourselves in providing education, outreach, and community relevant promotion across the state. We create consumer tested materials so that when people are either helping someone sign up for health insurance or they themselves are reading our materials, trying to understand their own coverage, these resources help them better understand what benefits they have and how to use them. Next slide, please. And so as I mentioned, our health insurance navigators, we provide free help across all 72 counties. We help folks understand their options and look for any financial help they may be eligible for regarding their plans. We help them sign up for healthcare.gov or the Medicaid program, Badger Care Plus. We help them understand their plan so that they can use the healthcare that they have. And then we also help with any questions around billing, coverage problems, or finding other charitable care or community programs for folks that may be uninsured or not eligible for some other types of coverage. And these are the organizations that we partner with, subcontract with, to make sure that we can cover all state. And we have currently 45 navigators across the 72 counties that we serve in different regions. And so we're able to provide assistance in person in most cases, as well as over the phone and virtually through vehicles like Zoom. And navigators are not the only types of enrollment assisters. And I use the word enrollment assister as kind of the umbrella term for types of people who help people sign up for health insurance coverage. And so that could be a navigator, as I mentioned, who are federally funded by the Centers for Medicare and Medicaid Services. They could be certified application counselors who are similar to navigators in that they help with the state's Medicaid program and the health insurance marketplace, but typically are found maybe in hospitals and clinics or community-based organizations that have that certification. And then we also work collaboratively with our agent and broker partners across the state who are committed to serving families that help people with Medicaid, help with the health insurance marketplace, and in many cases are partners in helping folks transition to Medicare when they're eligible, either an older age or if they have a long-term disability. But one thing to always remember is health insurance help should be free. And that's our first thing that we like to share with folks is that if someone is charging you to help you sign up for health insurance, that should be a red flag. And all of our coverage that we're talking about today should be free. So I'm going to transition it to my colleague, Adam.
Right, thanks, Caroline. Appreciate it. I think that context is really helpful for kind of setting up this whole discussion and of course why this topic is so important and so valuable for employers looking to keep their staffs covered and healthy as we go through this really interesting and in a lot of ways unprecedented time. Next slide. So looking at the big picture here, we're talking about health insurance and why this topic is just so important for everybody. And this health insurance access is kind of the window to care. And we could talk about just how valuable this is for employees, but as employers, what all of this means, the big picture for everybody. So when you have an employee who is covered one way or another, we'll talk about a lot of different programs and coverage types today and how to make sure people stay covered. That employee is going to be healthy, they're going to be happier, and they're going to be a loyal employee for your organization. People who are covered are more likely to seek preventive care and early care if they have insurance. And they're going to, the health insurance is going to support the employee well-being and retention. And that includes reducing absenteeism, so people just not showing up for work, as well as presenteeism, which is kind of the opposite. People show up to work when they really shouldn't, and they're not healthy and they're not able to do their best work. So when we look at the big picture here of health insurance and why this is so important, we're talking about the health of the individual employee, and that adds up to the health and well-being of your organization. Next slide, please. Next slide. There we go. So we'll talk a lot about what you can do to keep your employees covered, the different types of coverage. We're going to dive deep into special enrollment periods and really look at kind of this whole situation of what's going on, what's called the Medicaid unwinding, which is really why we're here and what we're talking about today. But right now, what that means is many of your part-time and lower wage workers are on Badger Care and Medicaid, Badger Care Plus in Wisconsin and Medicaid, and we can help them stay covered. Some of them, as this unwinding unfolds, are going to need to transition to other coverage, and we can help them review options, costs, enrollment timelines to make sure that they don't have a gap in coverage. In addition, we'll look at if somebody's coverage options look like they're unaffordable, their options to get into the health insurance marketplace, whether for themselves or their families, and connecting to an enrollment assister to like a navigator, like myself, like Caroline and other staff at Covering Wisconsin, to make sure that they get the expert help they need for free, as Caroline was saying, to connect to the best coverage for them and their family. And of course, we'll be going through some resources to help you and your employees stay informed with all the different information going on right now, and everything related to the unwinding. It can be confusing, but we're here to make that a little bit easier for everybody. Next slide. I'll go ahead and transition back to Caroline, who could talk about what you need to know about Badger Care Plus and Medicaid.
Yes, because before we can really get into what we're going through this moment, we want to make sure that you feel equipped to understand the state's Medicaid program, at least at the basic level, so that we're not just throwing numbers and such at you. So Badger Care Plus is the state's Medicaid program, which means it's the state offered free and low cost comprehensive health insurance program. And folks can sign up at any time. There is no open enrollment for Medicaid. If someone believes they may be eligible, they can enroll and find out through the income maintenance consortia offices, or essentially the local regional office will determine whether or not they are eligible or not. And during the pandemic, there were special rules that once someone applied, they were allowed to maintain their coverage even if there was a change in their income or household size throughout the end of more or less the public health emergency. It changed a little bit at the end, but for the sake of the fact that the public health emergency is officially over as of last week, these rules maintained where people could maintain their coverage. And just on this sheet, you see the Forward Health Card. Some people reference Medicaid or Badger Care as the Forward Health program because this is the card that people typically get when they're enrolled. And so I just wanted to put that as an awareness for you all in case you hear it referenced in different ways. Sometimes also Title 19 is a common way that people will talk about it. And then in the right corner, we just have a brief resource that you can click once you have the slides in front of you to show you what the eligibility is for adults, pregnant people, and children. And so then with this change in eligibility during the pandemic, it takes us to this moment, which nationally they're calling the Unwinding. You might also have heard Medicaid redetermination, Medicaid renewal period. But essentially it is the process of moving from this continuous eligibility where people were able to maintain their benefits for Medicaid to the rules and annual renewal cycle that existed before the pandemic. And so Wisconsin's goals for the Unwinding is to implement a successful return to those previous rules, including annual renewals, and then help Wisconsinites stay covered. So if they're no longer eligible for the state's Medicaid program, that we can help people transition to the coverage that they're eligible for, which in many cases could be employer-sponsored coverage or a plan on healthcare.gov. Next slide, please. Oh, thank you. And so Badger Care Plus and Medicaid, the renewal process is starting essentially right now. There will be renewals, not just all at once, but over the next 12-month period, starting with the first enrollment month being June 2023, or renewal month, I apologize, renewal month being June 2023, all the way to folks enrolling as late as May of 2024. And people can find out their current renewal month by creating an account on access.wi.gov or creating an account and syncing it to their Access account through My Access, which is an app that we'll talk about on a later slide. And one thing that we want to emphasize is that renewing too soon, so before their renewal period comes up, could risk them losing coverage sooner than they need to. And then of course, renewing too late could result in a gap in coverage. And we'll also talk about that quite a bit. But one of the messages that we've been sharing is know your renewal month and wait. So then over these last 3 years, as we mentioned, people have been able to maintain their Medicaid benefits, even though they may have found a new job from the time that they needed to enroll in Medicaid. And this will be the first time that folks are doing this renewal process for the first time in 3 years. And that includes both the Medicaid member, as well as all the folks that support the redetermination and renewal process at the state. And so we have to kind of look at the challenge at hand. We have 1.6 million people currently enrolled in the Medicaid program across the state. And before the pandemic, we had approximately 1.2 million people. So this is meaning that each month there will be a higher volume of renewals than we were even used to prior to the pandemic. And then everyone will need to renew over this next 12-month period. And then the IM agencies, or the income maintenance agencies that help people renew, will not be able to help everyone over the phone. And so it's been really important for us to equip our enrollment assisters and our key community partners to know how to use access.wi.gov to help people through the renewal process on their own, and also to get folks enrolled in the My Access app, because then they can check their renewal months and they can submit documents in a timely fashion and really feel empowered to know when they need to act. And the big challenge that we're very aware of here in Wisconsin is that there are going to be people that are no longer eligible for Medicaid that will need to transition to some other type of coverage. The Robert Wood Johnson Foundation and the Urban Institute have estimated that approximately 385,600 Wisconsinites may lose Medicaid coverage during this next 12-month period. And these folks will need to transition to some other type of coverage. And that could be employer-sponsored coverage, healthcare.gov, Medicare, or for some folks who may have uneligible immigration status, they may not have access to coverage after this transition and would have to look to the federally qualified health centers or community health centers or free clinics for care. One of the things that is also very important is that about 60% of the people that are losing coverage or potentially losing coverage are thought to be eligible for employer-sponsored coverage. So we're looking at a larger portion of this group that we would love to transition with ease to their coverage at where they're working. And to do that, we need your support, your partnership, and one of the reasons why we wanted to make sure that this information was in front of you. So one of the things that we have recommended are these following steps for members to know their renewal window, know their renewal date, and wait. And that is to download the My Access app, which with this QR code, you could share this with your employees and let them know that if they have Medicaid, they can download this app, connect it with their case number, Forward Health card number, or Quest card number. Quest card is the food share card. They can sign up for push notifications. They can know when they need to renew. It'll show them the month and the year, and then keep their contact information up to date. And then it will tell them when it is within their renewal window, when they can act. Next slide, please. And so, as I mentioned, the My Access mobile app is really a great resource. And one thing that we're very excited about throughout this last year, a lot of our partners, including Covering Wisconsin, and then of course the Department of Health Services, we've been really promoting the use and download of this app. And we've seen a huge increase, essentially going from around 300,000 individuals using this app to now over 600,000. So really doubling how many people are connected directly to their benefits. And so one of the things that I think is important is that this gives them the power to know when to do their next steps. And also, it doesn't allow them to renew on the app, but they can upload verification and documentation that they need to confirm when they are doing the renewal process. And then we wanted to just show you kind of what it looks like in the app where they can find their renewal month. So they can go into check benefits, they can tap Badger Care Plus, and then they can look for their renewal month. and it says your renewal month is, your next renewal is due May 2023. In this case, this is kind of a template example, but it would be sometime from June 2023 to May 2024. And checking the year is very important because we don't want people enrolling or renewing early. And then when they are within their renewal window, they'll get this little message that says, be sure to act by, and it'll give them an actual date that they want them to submit their renewal so that they don't have any gap in coverage and they can seamlessly find out if they are currently still eligible, and if not, transition to the coverage that they are eligible for. Similarly, this is where people can find their renewal date if they have an account directly on access.wi.gov. And they're able to go to renew my benefits. And when they click on that button, it shows them at the very bottom where their renewal date is and when they need to take action by. And then Covering Wisconsin has spent a lot of time trying to determine how to best help our partners and the members that are in need to renew, and how to make sure that they can find all of this important information. And so we've created a resource guide called Worried About Losing Your Badger Care Plus or Medicaid, where we walk through, one, how to download the app and where to find this information that we just shared with you today. And also how to find enrollment assist or assistance, like with a navigator or a certified application counselor that can help them with this renewal process or any questions that they have along the way. All right, and then I'll transition it to you, Adam. Thank you.
Thank you, Caroline. So that's kind of the phase one, right? We've got a ton of people, many of whom are your employees and people who are contracting with you who might be on Badger Care or Medicaid right now, who are going to have to participate in this process. They're going to need to renew their benefits, do a redetermination. Now, some percentage of those, some significant percentage of those people are going to be ineligible for Medicaid or Badger Care Plus. And we need to look at what other options there are and how you guys can help them find those, whether it's through their employer coverage with you or through healthcare.gov or some of these other options. Next slide, please. So health insurance from a job when losing Medicaid. And I'm going to kind of preface this with a small apology. We're going to be talking this section a lot about special enrollment periods, and they come in a lot of flavors related to a number of these different topics. So I'm going to try to take it a little bit slower and make sure we kind of don't cross any lines and know which special enrollment periods we're talking about at which time. I think a couple takeaways are, one, people have options, so they're going to have options, many of which you guys are probably going to be very familiar with. Other ones we can plug in and hopefully educate a little bit here. And then the other thing is, you don't have to be experts in things like healthcare.gov. That's what navigators are here for. That's what we're here for. And with these slides and the different resources we're offering, you can take these away and hopefully be equipped one way or another to inform the people you need to, including your employees. So typically, for a job, when you're losing other health insurance, you have a 30-day special enrollment period to get on the job coverage and other coverage, whatever it is. Now, there are a couple special rules related to these employer coverage special enrollment periods that are in place right now. First, if an employee loses coverage before July 10th of this year, July 10th, 2023, employers must provide a special enrollment period, a SEP, through September 8th of 2023. That's from the Department of Labor Employee Benefits Security Administration. So these longer windows, the idea here, and we'll talk about a few different longer windows, is to make sure we don't have those gaps in coverage that we referenced. Make sure that somebody transitioning from Medicaid or other coverage can stay covered without losing their insurance, without all the chaos and the hassle that comes with, and the potential risks to their health and all of those associated risks to them as an employee, and their well-being, their health, et cetera. So we want to make sure that we're minimizing those gaps, maximizing people's opportunity to get help and to enroll in other coverage. So that's the idea behind special enrollment period from the labor, extending that through September 8th, 2023. Now, after July 10th, people who lose Medicaid have a 60-day window to enroll. Now, this refers actually under HIPAA and under the Children's Health Insurance Plan Reauthorization Act. People who lose Medicaid specifically, lose Medicaid or Wisconsin Badger Care Plus, have 60 days to enroll in their employer coverage. So this is one that you'll be seeing throughout the pandemic, or not throughout this unwinding period. Now the pandemic has ended, people will have 60 days when they determine that they're no longer eligible for Badger Care Medicaid, 60 days to get into their employer-sponsored coverage, and we'll be seeing a lot of that throughout the next 12 to 14 months. Next slide. So guidance, there's additional guidance, talked a little bit about kind of the direction from the Department of Labor, but also guidance from the Department of Labor and the Federal Health and Human Services Department, is that, you know, employers can have a huge role here, a really important role to play in maintaining health coverage for your employees. And the Department of Labor actually recommends that you work with your issuers, with your insurance plans themselves, to extend that special enrollment period beyond that 60 days. So the 60 days required by law, under HIPAA, under the Children's Health Insurance Plan Reauthorization Act, you can actually work with those plans to extend that, again, to make sure people don't miss their window, because there's a lot of communication going out. There's a lot out in the media. There's a lot of confusion related to the unwinding and whether or not people are covered. And the state's doing everything it can, the feds doing everything they can, covering Wisconsin. We're here to help you make sure you do everything you can to make sure people get the right information and don't miss an opportunity to enroll. Department of Labor encourages plans and issuers to offer special enrollment period that matches up with healthcare.gov. So during this next time, we'll be talking about that special enrollment period, which goes through next summer. Next slide, please. So first, this is something that, you know, as HR professionals, and some of you maybe work very closely with this, are already going to be familiar with, but somebody loses Medicaid and they have an offer of employer-sponsored coverage, so your employee plan, and that coverage is considered affordable, they're going to want to take that coverage through you, because their options for financial help are going to be extremely limited elsewhere, like through healthcare.gov. So when we say affordable, that is essentially a math problem that healthcare.gov has worked out, that through the Affordable Care Act, saying it's this percentage, in this case 9.12% of your household's monthly income, to say whether or not that's affordable for that individual employee. So that may be something some of you are really familiar with. It might be a calculation you guys have been really familiar with doing to make sure your coverage is where it needs to be in terms of affordability for your typical employee. But so if somebody goes to do their redetermination for Medicaid and say, okay, I no longer have Badger Care Plus, if that employee plan is less than that 9.12% of their income, they're going to want to take that option, because that coverage is going to be affordable and their options are going to be limited elsewhere. And that's where HR departments, employers, you can really guide them through that process. That's going to be your bread and butter, most likely. Now, talking about people who need to have their dependents covered as well, their spouse, their kids, etc. There is news in terms of, I guess everything's moving really fast these days, but as of November 2022, there was a shift that is really positive in this case, where if somebody's coverage through their work is determined unaffordable, so over that percentage for their family, which it can be, because obviously family coverage is a lot more expensive than just that one person coverage, they can go to healthcare.gov actually and get financial help to pay for that coverage through the marketplace. Healthcare.gov, Obamacare Marketplace, we're using these terms interchangeably, but they can go to healthcare.gov and get their family covered while they then get on what's called the affordable plan for the employee. So if the household's family plan is more than 9.12% of that taxable income, they'll be able to enroll through healthcare.gov and get financial help. And navigators can help with that. We'll talk more about how to access us and how to direct people to us in a little bit. Next slide, please. So this situation is going to be a little bit more uncommon. We do have people who become 65 during the COVID-19 pandemic, while the eligibility for Medicaid was frozen. So there are people who are transitioning to Medicare right now, whether they're turned 65 or they have a disability determination. And we do have some really helpful links when you get these slides, when you get the fact sheets that you can use to refer to these resources, because it's important to know that navigators that do not help with Medicare specifically. We can provide general information, but we do not sign anybody up or transition anybody onto Medicare plans themselves. Instead, we will refer people to their local Aging and Disability Resource Center, or ADRC, or direct them to call the Medigap helpline. That said, there is a special enrollment period for people who need to sign up for Medicare. For Part A, Part B, there's a 6-month special enrollment period. And then for Advantage plans or C or Part D, there's going to be a 3-month special enrollment period. But again, there's some useful links on the slide here, including to the Social Security Administration website. And then the Department of Health Services has just put out a fact sheet as well, which you can see an image of on the right-hand side of your screen. Next slide. So we talked about transitioning to employer coverage. We talked briefly there about Medicare. Now, when people don't have access to affordable employer coverage, so talking again about that 9.12%, if it's going to cost more than that for themselves or their families, they can get help from the Federal Health Insurance Marketplace or healthcare.gov. When I say help, they'll be able to get tax credits based on their income to bring down the cost of those monthly premiums. That's really how healthcare.gov works. You go there, and if your income is low, you get help to make that coverage affordable. So we'll have special enrollment periods, let's talk about in just a second, throughout this whole process with the unwinding to make sure people can get to healthcare.gov if their employer coverage isn't going to be affordable for them. Otherwise, the open enrollment period for healthcare.gov is November 1st to January 15th each year. And we always encourage people and sign people up by December 15th to make sure they have coverage right away on January 1st. Next slide. So a lot of special enrollment periods we're talking about here, just a little bit more to digest, and we can always answer questions after this as well. This is a fact sheet we have available on our website in English and Spanish on special enrollment periods. And normally, if somebody loses coverage, they have 60 days to get into the marketplace. That's being extended, which we'll see on the next slide here, throughout this unwinding period for healthcare.gov. I would just like to underline and reemphasize the idea of not having a gap in coverage, though, to get the information into employees' hands as quickly as possible and to make sure that they have the information they need to act in a timely fashion. So it starts with the Medicaid determination, making sure that they act and renew as soon as they can, and as soon as their window opens, to, if they miss that, making sure they get on their employer coverage if necessary. And then if that doesn't work, getting into one of these other sources like healthcare.gov and making sure they get affordable coverage there. Next slide. Thank you. And then, so there is a new special enrollment period, one more, on healthcare.gov for anybody who loses Medicaid coverage between March 31st through May 31st of next year. They can sign up on healthcare.gov anytime before July 31st, 2024. So again, keeping in mind that people want to make sure they don't have a gap in coverage if somebody does lose coverage, whether it's Medicaid or so when somebody loses Medicaid coverage, they have this entire time to get into healthcare.gov. There's going to be other special enrollment periods. There's going to be an open enrollment period in there, but it's just important to know that that door is open and that people who lose Medicaid can get into healthcare.gov and will be able to get some help paying for that coverage. Now, to exercise this special enrollment period, they don't need to. They do need to attest that they've lost Medicaid. So, hey, I don't want to have Badge Care Plus, but there won't be any verification they need to submit with that, which will make that process a little bit easier. Once they've submitted the application, they have 60 days to complete it. So they kind of lock that window in when they time to choose coverage. But again, to avoid gaps in coverage, they should complete their healthcare.gov application for the last day of Medicaid coverage. So hopefully that was clear. Again, there's a lot of special enrollment periods to throw around, some of which you may be more familiar with than others, but just remember that Government of Wisconsin navigators, we're here to help guide you, provide information like this for you, and to educate and assist your employees whenever you need us to. Handing it back to Caroline. Thanks.
Thanks, Adam. So I think someone just asked in the Q&A, how can we make referrals to navigators? That was the big takeaway that they were hoping for after talking about these first sections. And now I'm excited to tell you that we are getting to that portion of our presentation where you can now know how to connect your employees to folks that are able to help them with enrollment assistance. First, I wanted to share a little bit of our screening resources that we have available, where people can either go on their own or if they're already working with an enrollment assister, to find out kind of what they're looking for in terms of options. And so there's a detailed screening on access.wi.gov that helps someone kind of see if they may or may not be eligible for Medicaid. We always recommend, though, if people aren't sure or they just want to know officially, to always enroll, to always apply, because it's really until you apply on access.wi.gov for coverage that you will formally know if you're eligible or not for Medicaid. And then Covering Wisconsin has a couple of resources on our website. One is a 2-question tool that's found right on our homepage, where people can just answer 2 questions and find out more or less what they may be eligible for or what direction to go in. And then we have a chatbot feature where someone can put in a couple of answers and also see what they may be eligible for. And then after they find out what they're eligible for, they can talk to a live navigator, which we'll talk a little bit later on as well. And then something that we also want to emphasize, especially when we're in any kind of transition around policy, or there's just a big change in how things are done, going from the policies that were happening during the pandemic to now trying to go back to status quo. There are a lot of times opportunities for bad actors to try and scam folks. And so we want to make sure that you all are aware that this is a possibility, and to make sure that you're getting your information from great sources like the Department of Health Services, Covering Wisconsin, and partners within our network. And at the same time, helping your employees know kind of what to look for to avoid getting involved in any of these types of scams. So of course, as I mentioned prior, health insurance access enrollment should always be free. So if someone's trying to charge them, red flag. If people are trying to ask them for personal information, they could ask questions about, are you licensed and certified with the state of Wisconsin? Are you showing me all of my insurance options that are available to me? And frankly, if they're also just not comfortable going into that conversation, and it just seems out of the blue that someone was reaching out to them and then all of a sudden asking them for personal information, they can hang up and then call a reliable source or whoever they reference to make sure that they were really calling them appropriately. And then our big takeaway is that all of the websites that they would use to enroll in coverage, healthcare.gov, access.wi.gov, they end in .gov. So not healthcare.com, not healthcare.org. We really want to emphasize .gov because that means it's a government site and it's legitimate. There are a lot of scam sites that are very similar, or if you try and Google, it can take you down a rabbit hole that you do not want to be in, especially because it may result in you getting a lot of unsolicited phone calls. And then if you have encountered a scam, you can report that to the Wisconsin Department of Agriculture, Trade, and Consumer Protection at the number below. All right. And then we'll get into the free outreach and education materials, which leads into how you can get connected to Covering Wisconsin and navigators like us. So the Department of Health Services, they have created a Unwinding Partner Toolkit, which helps folks understand kind of what is happening right now with this Medicaid renewal period or transition. And so there's ready-to-use flyers, social media tools, posters, and things like that that you can have at your fingertips, print out to your needs. And also you can work closely with Covering Wisconsin if you'd like them customized to your organization. We can help get you set up with a PDF that you can then print with your organization's logo, et cetera. And then the Department of Health Services also recently came out with a renewal news update webpage that helps provide some context to kind of what period we're in terms of who may be up for renewal at what time. And so if you want to share this QR code with your employees, this is another resource that they can have at their fingertips. Covering Wisconsin has also created a large library of outreach and promotional resources, including materials in English and Spanish. And we also are adapting many of those resources to Hmong. And then they're downloadable. You can print them on your own, or you can once again reach out to us if you'd like them customized, and then we can adjust them to have your logo and information to make it specific to your community. And you can find social media graphics and videos as well. And our colleague Tina Marshallek would be your resource to getting any of these materials customized. We also have our partner, the Milwaukee Enrollment Network here locally that works with Healthy MKE, where they create multilingual tools that feature local influencers in the greater Milwaukee area. And you can see those resources and access them through healthymke.com. And then Covering Wisconsin has developed a library of resources that help talk about health insurance in terms of options, various resources around the state's Medicaid program and the health insurance marketplace, and then some general health insurance resources that just help you understand common terminology and things to know when trying to utilize your benefits. And so I would suggest even going in there and seeing what you can use in your day-to-day work when working with your employees to help them better understand their health insurance coverage. We recommend that you follow Covering Wisconsin, the Commissioner of Health Insurance, the Wisconsin Department of Health Services, and healthcare.gov on social media, because many times we are sharing resources that you can easily just share out to your network and your partners and your employees, so that you don't have to reinvent the wheel. You can really just utilize these folks that are very focused in making sure that your employees are covered and sharing this really important information. And then if you are very invested in making sure that your employees maintain coverage and you want to be in the mix with all of these organizations that are making sure that we as a state are ready to help them with this transitional period of renewing and or transitioning to some other type of coverage, you can connect with your enrollment network. So across the state, we have these enrollment networks, which are organizations that are dedicated to making sure that there are no gaps in coverage and that people can get the coverage that they're eligible for, and also sharing information that is culturally and regionally relevant to their communities. And each of these individuals are leaders in their said region, and through connecting with Covering Wisconsin, we can get you connected to your region. All right, and then I'll transition to Adam.
All right. So yeah, we've talked about a lot this morning, and hopefully it's been clear. If not, we'll do some Q&A and hopefully fix all of that up. But let's go through and talk about our key messages and takeaways, things we really want you to remember from this morning's training. Some things related to the Badger Care Plus messaging. First of all, Badger Care Plus Medicaid members have coverage until their renewal date, until that very last date. We want to make sure that they have some really good information as we go into this unwinding period, because there's a lot. But first is to know their date and then wait. They want to use the resources. They want to read the correspondence they get from the Department of Health Services. They want to check their date in the My Access app, and then renew within 30 to 45 days of that renewal date. They don't want to act too soon because they don't want to lose coverage, but they do want to act in that window by before the end of the next month, ideally before the middle of that next month, but in that window, that 30 to 45 days before, so they can determine whether or not they have coverage without hitting a gap if they need to pursue another option. There's always going to be free and local help available. You can call an expert. We work with 211, so anybody can just call 211 in the state to find an enrollment assistant in their area. Also, the WIS Covered website will help connect to an enrollment assistant like Navigation Covering Wisconsin. Signing up for employer plans within 60 days of losing Medicaid. We talked about that in my section, where if somebody loses Medicaid, they are allowed 60 days to jump onto their employer-sponsored coverage, and HR equipment or HR professionals are best equipped to help people through that process. And then applying through healthcare.gov for plans by July 31st, 2024. If they lose Medicaid and don't have other affordable coverage, so they've gone through this process, they've done their Medicaid redetermination, where coverage isn't affordable, then they can always go to the marketplace, and they have plenty of time to do that. Employers, what can you do to help your employees? You can work with your planner issuer, like we talked about, to extend the special enrollment period through the one lining up with the one through healthcare.gov, so through July 31st, 2024. You can share your employees with them. You can share with them resources about HR, local enrollment assisters who can help them renew their Medicaid benefits. So if they need help at the beginning of the process, that's fine. That's us. We're here. If they've done that and they're not going to be eligible for Medicaid, they need to get on other coverage. We're here for that as well as just for general questions. So reaching out to Covering Wisconsin if you have any questions about any of this, and connecting your employees to navigators if they need further assistance, which again, at any point in this process, there is no question too big or too small for a navigator. And I don't know if this was me or not, but I can cover this. We are here to help. Hopefully we've made that clear, Covering Wisconsin. You can find our presence online. You can find our materials online. You can also schedule directly with a navigator. So somebody like myself or one of our navigator staff to help your employees. You can go right to coveringwi.org/enroll. You can also do that in Spanish, or you can find our number online, the 608-261-1455. Connect with a local enrollment assister through 211 as well. So really easy to find online. And we actually have a chat feature on our website as well, just by going to coveringwi.org. And you can actually chat live with one of our experts, one of our navigators who can help kind of answer those general questions for you or your employees and make sure that you have a good understanding of the process and know your next steps. You can talk live with an expert. Next slide. All right, we have an evaluation link, and I think Stephanie, it's back to you.
Yeah, so we do have the link here, but when we send out the slides and the recording, we'll also have a link for the evaluation. And I just want to remind everyone, Covering Wisconsin is predominantly grant funded, and we really do depend on those evaluations to report back to our funders. So it'd be really great if everyone could fill it out, but I'll be really happy if I get 50%. But please fill it out. So let's look at some of the questions that we've had. I know there were some questions about the resources. So hopefully that last section about where to find resources, where to find the income numbers. We have sheets, we call them how-to sheets. We have sheets on all of those topics. So if you just go to our website, you can find them there. So let's see, here's another question. How will this impact the unwinding individuals with chronic illness?
Yeah, and I said I just want to answer this one live. There isn't, there aren't special exceptions or anything you need to know specifically about people with chronic illness, other than the fact that these are going to be some of your most vulnerable employees. These are going to be people who are the most keyed in to understand kind of the whole ins and outs of what's going on with their health insurance. They're also going to be some potentially of the highest anxiety cases you have around making sure that they maintain their coverage. So it's possible that they will continue to be eligible for Medicare Plus and Medicaid based on income. They may qualify for a Medicaid program related to having a disability or this chronic condition. But really the main thing is just to make sure that they're well informed, that they know their options, that they don't miss any of their dates, because the last thing that somebody with a chronic condition wants is a gap in coverage. So we want to make sure that they have, they're fully informed and have access to enrollment assisters like navigators if they need them to transition to other coverage. In most cases, between Medicaid and the marketplace, with employer coverage in the middle, they will have a good chance of being able to maintain their health plan through with their health maintenance organization, their HMO, their insurer, but really just working with them directly to make sure that they have that information and don't miss a window. That's key, because the last thing we want is somebody's health and well-being to be impacted by a gap in coverage.
Okay, the next question gets down into the nitty-gritty of the dates of effective coverage. So does the effective date of employer coverage go back to the date following the loss of coverage when they enroll within the 60-day special enrollment window, or can they choose the effective date within the enrollment window?
That's a great question, and it does vary from employer and their health insurance plan or issuer, depending on how they essentially effectuate coverage or when they start their coverage. But typically, and this is kind of our rule of thumb, especially with someone who's losing coverage of any kind, but in this case, particularly Medicaid, is that once they know that they are no longer eligible for that other type of coverage, to try and transition or enroll in the next type of coverage before the date they lose their original coverage, because in doing so, typically we can get the start date to be the following start of the next month. So for example, if someone is in this current renewal window, which if folks are getting their letter from the state to renew their Medicaid this week, their renewal window would end June 30th. And if they were found no longer eligible, if they lose that coverage, we would want to get them enrolled in their employer coverage so that their coverage could start July 1st. Or if it's the marketplace, same situation. And so really what we recommend is the sooner, the better that they can get in touch with an enrollment assister, a navigator like us. That's great. Even if it's just to answer questions, they might not even need to renew until October 2023 or April 2024, but we would rather talk to them now just so that we can help them get set up. We are currently booking appointments throughout the year if people know their renewal month, so that one, they already have a date on the books of when they need to act. And then two, they have someone in their corner that will help remind them what they need to do next. Our navigators, when we set up an appointment, the person will get a text that says when their appointment will be, and then they'll get a reminder text right before the appointment actually is. And our navigators will also, in many cases, give them a warm phone call just to remind them that that's coming up.
Okay, this one overlaps a little bit with the last one, but I want to make sure we clearly answer it. For folks losing coverage on 5/31, if they apply for and select a marketplace plan, does the coverage start on June 1 or July 1?
So for folks losing coverage and they apply before they lose their coverage on May 31st, they would start their marketplace coverage as long as they selected a plan on June 1st.
And the last one, are printouts being sent to our emails of this presentation? And I can answer that. Yes, for everyone who registered, we will send out an email with the slides, the recording, a handout, and the presentation have links to all of the references and handouts that we referenced. So, okay, so we'll just hold for a couple more minutes and see if there's any more questions. I just wanted to direct everyone that both Caroline and Adam's email is here if you want to reach out. They really are our experts in this topic. And Covering Wisconsin is here. You might see us advertising locally, digital advertising, and it helps us get the word out to everyone who needs help, that you help legitimize that we are an actual grant funded navigator agency. Because sometimes it's hard to know who to trust when you're signing up for things like health insurance, because we certainly all have probably received those scam offers. And there's already been an uptick in scams about this transition. We've seen a lot in other states, and I believe some of those scams are arriving now to Wisconsin. So people are just really trying to take advantage. Okay, any closing remarks from Caroline or Adam?
Honestly, I'd just like to thank everybody for their interest in this topic. This is a group we're really excited to present to. And this is, again, I think I used the word unprecedented earlier, but this is a very interesting time, and we want to make sure we do everything we possibly can for people in Wisconsin to make sure they maintain coverage, and that, including and especially employees who haven't had to experience or deal with a lot of this yet, just because of the way that everything played out with the pandemic. So that, and just remembering that we are here to help. You don't have to remember everything you saw this morning or whenever you get a chance to watch this. Covering Wisconsin can answer your questions, and we'll be here to assist your employees.
And I do have one other question that came through for Caroline. Can undocumented individuals with chronic illnesses apply for Badger Care?
Oh, so that's a wonderful question. And unfortunately, in some cases, undocumented individuals do not typically qualify for standard Badger Care Plus. There is a program called Emergency Services where there are situations that an undocumented individual could qualify for coverage during the time of an emergency, but there's a little more nuance to when that is possible. We do have a resource that talks about immigration eligibility, and we hope to do an immigration eligibility training in the future, similar to this one, where we specify the particular details of various immigration statuses, including our folks that are undocumented. And I was just going to finish as well in saying that we also can use your help sharing this information. It's a recorded webinar, and we know that there are far more employers and HR professionals across the state that we would love to get this in front of. And so if you are connected to associations or networks, please feel free to share this recorded version once you have access to the YouTube video.
Caroline, another question did come in. It could be for either you or Adam. Someone with diabetes, so chronic and can't afford copays for medications, can they keep Badger Care with a premium?
Sure. So certain populations have Badger Care with a premium. I think that they might be referring to a specific spend down application of Badger Care here. But in most cases, no, that's not how that's going to work. There are resources, a lot of different resources to help people pay for medications and find medications that are affordable and get discounts and things like that. So in that case, I would recommend that they refer to a navigator, to refer to Covering Wisconsin, to make sure that they're exploring all of those options and resources that might be available to them to figure out how to get those medications the most cost-effective way possible.
And I also saw our partner Maciel come off mute. Did you also want to share something, Maciel?
I just wanted to say it doesn't hurt to apply for Badger Care Plus. It doesn't cost anything. Badger Care Plus is open all year round. And these particular questions are situational, and I would like not to deter somebody from applying. It really depends on their situation. It depends on whether or not they qualify and meet the criteria for Badger Care Plus or state Medicaid. So in instances where you're unsure, again, it does not hurt to apply. Please complete the access application, submit that, let the IM agency or the income maintenance agency or consortium determine whether or not that individual meets the criteria, and then you can go from there. If the navigators can assist them with any other resources that are available, but I highly recommend in situations where an individual is undocumented to connect with their local federally qualified health center. They are able to assist individuals who do not meet Badger Care Plus or Medicaid criteria and get that eligibility. They can receive services on a sliding fee scale, and they work with them to go ahead and try to access medications that are more affordable to them. So there are resources out there. However, I would hate to give a blanketed answer to a question like these recent questions, simply because I would like to have that individual apply and be looked at on their specifics, rather than giving you a blanketed answer and saying no.
Yeah, thanks, Marcia. I really like that answer.
Absolutely.
It's definitely comprehensive, and I appreciate that. Yeah, in my answer, I was thinking of them as already being ineligible just based on income, but you're right. We don't know everyone's situation until we look at it. And certainly anyone has the right to apply for Badger Care at any time they want. So definitely don't close any doors before you've explored them.
Yeah, I would just add, send them to a navigator. The navigator is going to walk them through whatever application or process that and know where the resources are in the community. So which can be nice, because sometimes when you apply for something and you get a no, it feels like a huge barrier. And so having someone who's just already there ready for the next step to help you through that process can be really helpful.
And if I could speak to those individuals who may have experienced a disability or a change in their level of need, and from going from regular Badger Care Plus to possibly needing elderly, blind, or disabled services. The income maintenance agencies or the consortium should be looking at those cases and testing them to see whether or not they qualify for the elderly, blind, and disabled EBD eligibility. So if you have a situation where someone has had Badger Care Plus throughout the duration of the pandemic and their cases are being looked at for their renewal or recertification, please feel free to go ahead and notify the IM agency that you're interested in having that case tested for EBD before moving on to something else, because perhaps they could stay on Medicaid. They just need to be tested for those categories.
Sounds good.
All right. Well, thank you everyone for joining. We're always here to help with questions and referrals. So feel free to reach out and contact us. And if you just have some general questions, you can also use the chat feature on our website, which is open from 9 to 4, Monday through Friday.
And then thank you one more time to all of our sponsors, the Business Healthcare Group, the Alliance, the Milwaukee Healthcare Partnership, and the Milwaukee Enrollment Network, alongside with us at Covering Wisconsin. We were just so glad to be able to reach you today.
Absolutely.
Thank you so
Thank you.
much.
Take care, everybody.